And I think today's case really does lead nicely into what we're going to touch on here, sort of looking at a combination of some of those formal support systems that exist, and also, how to really use all the informal supports to help support, a young adult as they're moving from sort of school age into the adult world. So we can certainly have time for questions at the end. We'll try to give sort of some higher level information. And then when we send out resources following today, that will have also a lot more sort of detailed places that you can go for information. So in general, when we're thinking about this transition to adulthood, we want to really keep in mind that sort of person-centered perspective with the overarching theme of quality of life. So, all of these sort of aspects of things we do every day. What do we do? How do we live? Who do we spend time with? How does all of that feel? And then maybe what are those supports that are needed to help somebody really reach their full potential and live a meaningful life beyond high school and into the adult world. You can go to the next slide. So we do want to kind of note and highlight that this is a time period that's defined by lots of different changes. And, what age we mean when we talk about transition can really vary, but in general, we want to make sure that all of our families are starting to think about this by at least age 14, ideally even way before that. But in a more formal way, in Pennsylvania and New Jersey, transition planning for school should start at 14, and then just kind of really starting to think about what are the skills we want to really build, what are the different options we're going to have as this person starts to get closer to the end of their time in school. This is a time where individuals have a lot of physical changes, identity changes, so that can be sort of socially or interests that change, or, kind of finding a new path or something that they want to spend their time doing. The support system change is a big one, so we'll spend some time talking about that. And then environmental changes. So, young people in general are going to school for the most part from the time they're very, very young through, in this case, age 22. So that's a really long time of having this sort of structured, predictable place that you're going almost every day with a few breaks mixed in. And so that shift alone can have a lot of implications. And these are all things we want to keep in mind. And then just remembering there really is quite a variable developmental trajectory depending on the individual, and wanting to really find those areas of strength that someone mentioned, I think, looking back at the IEP. So what are the things that somebody's been really good at or has really enjoyed doing, and how do we take those things and sort of grow them into meaningful things to do as an adult as well? You can go to the next slide. So when we're thinking about transition, this is sort of a list of 10 areas, although there certainly could be more than this, that we really focus on when we're thinking of kind of what are the options and what are some of the key areas or key domains for planning. So education would be one. So we really want to think about after high school, is this an individual who wants to continue formal learning, either in a trade school or a post-secondary institution or a community college? Or, there are a lot of colleges that offer now certificate programs or have programs specifically for individuals with intellectual disability who really want to kind of continue on that learning pathway. So education is something to think about. And then employment, which we touched on a little bit today. So every state is going to have some version of Office of Vocational Rehabilitation. And this is not autism specific, but this is an organization that exists to support individuals with a whole variety of qualifying disabilities in sort of building meaningful careers and giving them the support and skills they need to kind of reach whatever that potential is, whether that's part-time work, full-time work. They have some resources to support individuals who are continuing the education. Sometimes they can help with driver training in certain cases. So this is definitely an area that we want to help talk to families about and make sure that they've been able to contact their local Office of Vocational Rehabilitation and start the registration process. And typically we want that to happen about 2 years before someone's going to finish with school. So for some of our individuals, that might mean they're graduating at 18 with kind of their classmates. And so we'd want them registered by 16. If somebody's staying in school until right before they turn 22, then we can wait a little bit longer. But it's really important to talk to families about the options that exist there and make sure that they've been able to make that connection. government services, which we'll talk about a little bit more, but this is where those county services and Medicaid waivers come into play. And these are going to look quite a bit different than when someone's in the sort of children's system of care in the educational system. Housing, and so this can mean lots of things. As one of our questions asked, is this somebody who's going to qualify for funding for housing? Or if not, what is our plan for that? So for this young man we talked about, he's got 2 caregivers that, have hopefully many, many years of being involved and being supportive for him. But at some point, that might not be an option. They may not be able to care for him anymore, or that home may not be the appropriate setting. And so we want to know, what are the different sort of supports that exist. There are homes where a couple different individuals with disabilities live together with caregivers. There are programs where other families open their home to bring in an individual who needs some support. There are programs for sort of supported living where somebody lives mostly independently but has caregivers that check in on them. So really starting to think about what that's going to look like for someone. Daily living skills. So this is just sort of across the board when we talked about, what are things that somebody's able to do independently versus is going to continue to need support with. Medical care transition. So again, in this case, it sounds like this was something that the family really thought about, and they were able to transition to adult providers and took the necessary steps to make sure that, that one of his parents was able to do some of the medical decision making. And in Pennsylvania, anyone can designate sort of a medical decision maker. And it can be a little bit of a more informal process, but every state is a little bit different in how they handle that. So making sure that before someone turns 18, we've talked with families about, what's the plan going to be for medical care, medical decisions, because sometimes it's a shock that, an individual turns 18 and their parent or caregiver calls to try to get some of their medical information, and they might be denied that information if these steps haven't sort of been taken proactively. Transportation, again, we talked about is this somebody who can get around independently using public transportation? There are different travel training options where people can sort of learn to practice using public transportation. Is this someone who might want to drive? There's, different driver training programs that sort of help assess how ready someone is and see if they have the skills necessary for that. Or again, is this somebody who might need a more supported transportation? And do we want to have, some funding for that to get them to appointments and things like that? Financial independence, having conversations about what that's going to look like. Also understanding that if someone is getting some public benefits, how financial status can impact that, and making sure, that we have an understanding of the amount of money an individual can have and still receive things like supplemental security income or, other funding in their name without it impacting their benefits. And then a big one is just sort of, what do you enjoy doing? So what are the hobbies somebody has? What community activities do they like to be involved in? And how do we make sure those things continue to be part of their life? Again, sometimes these are more easily accessible in sort of a children's system, but they shouldn't go away when someone ages out of school. We want to really make sure we're finding opportunities for those interests and those hobbies to continue. And then supported decision-making, which is where we would include things like guardianship. But there's a whole range of sort of options within this. And actually, in Pennsylvania recently, there was some new policy that came into place that's going to make it actually very challenging for families to get full guardianship. And part of the thinking there is that we really don't want to take away somebody's autonomy or somebody's ability to make decisions for themselves, even if there are areas where they might need support with that. So knowing, the different ways that somebody can have support for making decisions and being able to assess, well, maybe medical decisions, they need some help. But when we're talking about like what they like to eat or what they want to get at the store, this is an individual who might be able to really have their own preferences and make those decisions. So we want to have a good balance with kind of how we're supporting people in that long term. Go to the next slide. So the one domain I want to make sure to really highlight here is that services, those sort of formal support services. And I think with the case we had today, this was really evident that this wasn't explained well to this family. And so when we're talking about children's system of care, generally things through the school system, we consider those entitlements. So, a child with a qualifying disability is going to be eligible for getting a free, appropriate public education and all of the supports that go into making sure they're making meaningful progress. That's regardless of the family's income, sort of regardless of what the disability is and what the level of support need is. You can click that slide one more time. In the adult world, though, we move to really looking at an eligibility-based system. So here we're looking at somebody meeting criteria in terms of eligibility and financial guidelines. So when someone turns 18, all of these systems now look at that individual and what their sort of financial needs are rather than the whole family system. But we really have to meet eligibility under these multiple categories and levels of need to just sort of determine what formal systems are going to be available to support someone. Go ahead to the next slide. So this is where those Medicaid waivers that we were mentioning earlier come into play. So every state is going to have some version of Medicaid waivers to help fund services. And that's going to look a little different depending on where you live. But I'll touch a little bit here on Pennsylvania and New Jersey, since I know we have, people from both of those. But every state gets Medicaid funding, and they're required to have some type of waiver system. And what a waiver really means is that, this funding is meant to support individuals with disabilities in being part of their community, living in their community, and participating in meaningful ways, rather than having to be removed from their community and, put into an institution somewhere. So the goal is that we're going to provide all of these supports to give somebody that quality of life and sort of meaningful adulthood. So in Pennsylvania, as Judy was mentioning, the things that we're primarily looking for, updated IQ testing if we're thinking about intellectual disability, updated autism assessments, or just sort of verifying that this person does meet criteria for autism spectrum disorder, and then updated adaptive functioning. So as you see on kind of the final bullet point here, what Judy was mentioning is that in Pennsylvania, an individual needs to either meet criteria for intellectual disability or autism with significant adaptive functioning needs. And so we need to have pretty current documentation for families in order to be able to access those services. And in Pennsylvania, again, we keep talking about county services. Pennsylvania functions as a county by county state, which means that each of our counties is going to have an office of intellectual and developmental disability services. And that's going to be the entry point for families when they want to start this process of registering for eligibility. They do not have to wait until their child is graduated from high school. In fact, we prefer that they don't. So as soon as we know this individual is going to be eligible and we have the right documentation, we want to go ahead and start that registration process, knowing that we're in most cases, 99% of the time, we're not going to access that waiver until they have exited school, but we can get them registered, have the county be aware that this is an individual who's going to move into that adult support system at some point, and sort of get the family started on figuring out what that's going to look like. In New Jersey and in many other states, this is done at sort of a central state level. So New Jersey has something called the Division of Developmental Disabilities. Criteria are going to be very similar to Pennsylvania in terms of who's going to qualify, but they have only one Medicaid waiver in New Jersey, and it has different tiers of support and funding. And so New Jersey, families at 18 are going to start the registration process. New Jersey's very good at trying to keep students enrolled in school until 21 if they meet criteria and have, autism or another qualifying disability. And they use those kind of transition years and have a pretty nice streamlined process where families should start the registration at 18. They'll determine eligibility, they'll determine level of need, and then when they graduate at 21, they should be ready to start, kind of getting the right supports. You can go to the next slide. So now I'm going to hand things off to Katie to talk a little bit more about sort of what some of this person-centered transition can look like.
Sure. Thanks so much, Susanna. Great. So we were really thinking about how well this aligns with the case study today, especially because it seems like with some components of person-centered planning, I think a clearer idea of what that person might want their future to look like and how that can be achieved would come through. And what person-centered planning is person-centered planning is an approach to support a person in living the kind of life they want for themselves. That comes from the National Quality Forum. One of the resources we have on the resource sheet for today is their standard guidebook and definitions and background on person-centered planning. But you can think of it as a concept that can also be done as a process to get a better understanding of what a person wants their life to look like and what it will take for them to get there, which will likely involve a variety of supports and services, just like all of our own lives do. Next slide, please. There are a number of models for person-centered planning that have been established with varying amounts of research conducted on them. But I noted a few here and tagged them as well. So the first thing I already noted is the person-centered planning from the National Quality Forum. That's not a specific model with associated resources and materials. That's a general overview. If someone wanted, or an organization wanted to use the concepts to essentially develop what their own person-centered planning model would look like. The next three are specific developed person-centered planning models that many organizations or even at the state level use. Those are charting the life course, path, and maps. They all have pros and cons. We've also developed each of these. Some focus a bit more on what the representation of the person's vision looks like. Others dive a bit more into the support side of things. How will the person be supported to achieve these goals? But they all follow those same principal concepts of person-centered planning. The one we're going to dive into today is charting the life course. That's adopted in Pennsylvania as well as in, I think, over a dozen other states. I'm not sure on New Jersey. I actually, once I saw that we had someone here from New Jersey, I tried to quickly look it up. I will say clearly it's a focus among organizations in New Jersey because I saw quite a few resources, webpage links, etc. I'm not quite sure if the state has adopted it as part of their model of individualized supports planning as they have in Pennsylvania. Next slide, please. So what is charting the life course? Charting the life course is a framework for an individual to work with people they care about, to think about what their vision for a good life looks like, what it's going to take to get there, and how they can make that happen. The idea is that all people have the right to live, work, play, and pursue their own life aspirations. This actually relates to something Judy mentioned earlier, which was the idea that it may be that this individual isn't strongly interested in working outside the home. And so while employment is often a part of a meaningful life for people, if at this moment that's not the right fit for him, that's a vision he's establishing for himself. But the piece that we do want to ensure that we've done is allow the individual to fully explore all opportunities available to them with the knowledge that supports and services can be provided to enable them to access and pursue something that they may have ruled out, either due to low expectations or the understanding that it simply wasn't something for them, so to speak. So charting the life course involves generally starting by sitting down to do a planning meeting. This will be a few hours. I actually did one this morning with a person who is going to be starting our inclusive post-secondary education program at Temple. It's a student with intellectual disability and autism who's pursuing a 4-year certificate program. Sorry, I was just checking to make sure where I was at on time. We talked about what he wants the next 4 years to look like, what supports he needs, and how that fits into his overall vision for his life. Next slide, please. A few of the resources I wanted to share here from Charting the Life course, which are all available online freely to you, even if you're not working with an organization yet who uses Charting the Life course, they're excellent conversation starters for around the dinner table, for you to have, if you have a few minutes in the car to talk with your loved one. It outlines life domains. These almost perfectly map onto what Susanna shared as another version of life domains described, particularly related to transition. But these list daily life and employment, community living, healthy living, safety and security, social and spirituality, and advocacy and engagement. What they also do within Charting a Life course is talk about life stages, the idea that all of these domains generally apply across life stages, but they may look quite a bit different. When you're at the prenatal or infancy stage, advocacy likely isn't as much a part of your life, but things like healthy living or safety and security are key. So we explore these. When it comes to transition, though, we have a few that we hone in on, and I wanted to show you those on our next two slides. We can go to the, great. Okay. So the one I wanted to focus on here was daily life and employment. This is going to be a big part of ensuring a successful transition, is having conversations about what the person wants for their daily life. What's important to them? What have they liked in the past? What have they not liked in the past? Relatedly, what do they want in the future? What are they sure they don't want in the future? And from there, you build out the supports available to the person and create a plan for them to access those supports and go after that good life that they desire. So moving on to the next slide is actually a list of questions you would ask as part of the person-centered planning process to come to these conclusions. So that's why I noted why some of these things were valuable from what Kate shared about the student, is it would be helpful to have some of these, or the individual, I should say, as a teacher, I default to student, have some of these conversations so you have a better understanding of not just is the person happy in the moment, but are they fully thinking about the vision for what they want in the future? And are they on the trajectory or path to be able to achieve that? It's especially relevant when we think about things like what Judy noted, or actually it was someone else who noted, the family may not always be around, or the parents who are the key supports. So thinking through how those things change across life domains. Next slide, please. So the other area I wanted to highlight today, even though I'm a big fan of all of them and think they should all be discussed with transition age individuals, was community living. Oftentimes we see that youth often default to saying, well, I'll live with my family, because often that's all they've known. But this is a good time to start having a conversation about what are the options available to you? What would it look like for you to do that? What supports might you need? What are the pros and cons of that kind of thing? And starting to just explore opportunities, even if someone is satisfied with where they're at right now, can be valuable. But the nice part about Charting the Life course and all their materials is that they really help you think through this comprehensively. So in thinking about community living, it's not just about the physical space. It's about, well, what parts of the community would you enjoy participating in? How would you physically access those things and get there? What supports might you need in the home? Next slide, please. And then lastly, here's another list of those conversation guides. These can and should be done as part of a formal sit-down person-centered planning process. But as I noted, they're also really helpful conversations to be having with your loved one so that they're starting to think about and consider how they feel about these questions, and maybe even exploring them a bit as well too. As I noted, the similar materials to these are available across all of those life domains that I shared on the first slide. So I encourage you to check them out and use them as a guide to having these big conversations about what a good life is to your loved one, especially because most of you are right in that transition age range. Next slide. Great.